boom bust behaviour is a term that was first coined by well-known pain scientists David Butler and Lorimer Moseley in their famous book Explain Pain. This pattern of behaviour or repeat flare-up cycles is also referred to by Canadian expert Greg Lehman as persistence coping. So in this video, we're going to take a look at how persistence coping or boom-bust cycles might affect somebody with persistent, recurring or ongoing pain. This line here represents the point at which pain will come about or pain will increase in response to an increase in physical activity. So if we push past this point to some extent, things are absolutely fine. We are not trying to avoid all increases in pain. What we are concerned about is this point of flare-up. So what do we call a flare-up? Well, it's a point of increased intensity of pain that is quite dramatic, a point at which our nervous and pain systems kick in to protect us more dramatically with increased pain. We're concerned when this takes several hours or a day or two to recover from, and particularly if it's leaving us incapacitated at least to some extent. Now, it's important to stop down and note here that we are concerned about a repeated pattern of these flare-ups. The occasional or accidental flare-up in someone with long-term pain is not a concern at all. We are confident that in the vast majority of people with long-term pain, flare-ups just represent an irritation of the systems, not structural damage to body parts and tissues. But if we take a look at this more worrying pattern of repeated flare-up response and the need to recover over prolonged periods, we can see that the nervous systems and pain systems can start to adapt in a very unhelpful way. They will try to protect us by making themselves more and more sensitive. So over time, with the repeated pattern of flare-up, recover, this boom-bust cycle, the pain and nervous systems become more sensitive, leading to an easier increase in pain, an easier triggering of flare-ups, and overall, a really poor decrease in activity tolerance. If this is a pattern that seems familiar to you, then it's something you may need to address to recover from your long-term pain.